Well, hi, this is Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg. If you or someone you care for has been injured from no fault of their own, please contact Cartier, Bernstein, Auerbach, and Steinberg at myinjuryli.com or call 631-654-4900. Whether auto or work-related, slip and fall, trip and fall, construction accidents, dog bite, medical malpractice, or nursing home neglect, or various other types of negligence, please contact me at Cartier, Bernstein, Auerbach, and Steinberg by visiting me at myinjuryli.com or call 631-654-4900. I will represent you with integrity and passion. Living in pain from no fault of your own can be emotionally and physically detrimental and affect all aspects of your life. Please contact me, Ken Auerbach, at Cartier, Bernstein, Auerbach, and Steinberg by visiting myinjuryli.com or call 631-654-4900 for an immediate and free consultation and the support and representation you deserve. Well, hi, everyone. This is personal injury attorney Ken Auerbach from Cartier, Bernstein, Auerbach, and Steinberg. Welcome back to our program, From No Fault of Your Own, on the air here with my amazing associate and co-host, Amanda Spin. Amanda, how are we?
Hello. How are you?
Well, I'm doing just fine. Thank you. Beautiful day out today.
Beautiful day.
Yeah, it's really nice. So, folks, it's our goal to give you an insider's view of bringing and proceeding with various types of personal injury actions caused by the negligence of other parties. And among these areas that we have explored, and we're going to continue to do so, are car accidents, trip and slip and falls, construction accidents, medical malpractice, nursing home neglect, products liability, and the serious injuries that often occur. And through our journey together, hopefully we have removed a lot of the mystery and uncertainty and made you feel empowered, knowledgeable, and confident, and we're going to continue to try to do that for you. We are live today, and so if you'd like to call in and ask us any question about personal injury, please do that. We'd love to hear from you. You can call us at 631-451-1039. That's 631-451-1039. And if you do call in, you'll get one of our what, Amanda?
You'll get one of our great From No Fault of Your Own t-shirts.
So we'd love to give you one of those, and more importantly, we'd love to be able to talk to you and try to guide you and give you information that could be helpful for you as you try to go through this process of getting recovery and getting hopefully a fair and just recovery in the area of personal injury and for the injuries that you suffered as a result of someone else's negligence. So one of the things that we've talked about on the show, one of the areas has been medical malpractice, Amanda, and it's an area that we practice in, and we've been practicing for a long time in. It's kind of a unique area from the standpoint of it's different from other personal injury cases, right, Amanda? Because you don't automatically know if something's medical malpractice, right?
Right. It's a lot different from a car accident where you might have a rear end and you would say, okay, the liability is there. You would say that right off of the bat. It's a lot different in that you do need to look at the medical records. You need to speak to a physician and make sure there is a case. So it's a lot more complex, I would say.
Yeah, and one of the things that's important in the process of evaluating on medical malpractice is to recognize the fact that you have aspects of, you have to prove that there was a departure. And what we mean by departure, we're saying that someone did not do, or doctor didn't do, a medical doctor didn't do what they should have otherwise have done, or a hospital, or they did do something they shouldn't otherwise have done. And the way we're able to show that is there's custom and practice. In other words, there's what we call a standard of care in the community is in terms of what a doctor should be doing or what a hospital should be doing, and whether or not that particular physician or medical facility met that standard of care. And that's why we have to go and speak to a medical provider in that area specific of medicine as to what the standard of care is. Now, sometimes it could be obvious. As an example, if somebody goes in and they're supposed to have their left leg amputated, but they amputate the right leg, it's obvious you shouldn't have had that happen. That's not really usually where most of the cases come from. It's more obscure than that for us to actually be able to analyze it. We have to look at medical records. We have to assess those records. We have to listen to your story carefully in terms of what actually otherwise did or didn't happen. And that allows us, by doing that, to then assess what you say as against what the medical records say, Amanda.
Right.
Now, there are times when you'll come to us and you'll believe something occurred in a certain way, and it may be very different, or the records may show something very different. So that can mean a couple of things. It can mean either you had a different perception of it, or it could mean as possibly that they were not reflected properly in those medical records in terms of what happened. And we have ways to analyze that. We have ways to determine if, in fact, what is actually in those records is accurate, isn't accurate. But in the process, it's not just a matter also of only having a departure, which is negligence, right? So someone did something they shouldn't have done, or didn't do something they should have done. There's another part to it, Amanda, in order to have a case. You have to then prove that as a result of that departure, that failure, that negligent act or acts, we have to also prove what?
That it caused you damage.
Right. So we've had clients that have come to us at times where they've come to us and clearly there was negligence, right?
Yes.
And but we've looked at it and we cannot causally relate any type of injury as a result of it. And so clients have said to us, well, I could have been killed, as an example. And we say, you're absolutely 100% right. Thank God you weren't.
Right.
But we have to only rely on, in terms of bringing a case, we have to be able to prove that it did cause injury. And the worst case scenario is that it actually caused a death.
Right.
And so those are cases that we look at very carefully. And as we're doing that, we're assessing all of those aspects of it. And those aspects may or may not be clear. So, Amanda, today I got good news. Okay, really good news. My nephew is actually opening up his own restaurant and bar.
That's
basically.
amazing.
Yes. So Petey Mitzos is out there, and his mom is Suzanne, who I love so much. I love Petey. I love the whole family. And my nephew is reaching his goal. He just closed today on their restaurant. They're going to be opening a bar restaurant in East Patchogue on South Country Road. We believe they'll be open in the middle of mid-August, and it's called Taps and Caps.
That's awesome.
And so we're so excited for that. Really, folks, we'll let you know when it's open. And I can tell you that if you've ever met Petey, he's a special person, incredible person. And he does have more hat caps, than any human being that I've ever met. There is literally nobody that I know. So it's awesome. So if I ever needed a cap to borrow and I really didn't know where to go for it, I go straight to Pete. I don't even go online. I go to Pete. So Petey, we're really, really happy for you, proud of you, looking forward to it. And we're going to get a bunch of people to come down there. Our law office is going to come down there and definitely spend some time down there. And so it's exciting news. So let's just get back, if we can now, and talk about medical malpractice and some of the sort of sub areas that we work on. And one of the areas which are very serious and that we do and have done many cases, Amanda, comes in the area of misdiagnosis of cancer.
Right. Failure to diagnose, misdiagnosis. Yes.
So you have a failure to diagnose or a misdiagnose. And cancer cases, of course, folks, can be devastating. They can be devastating because depending on the type of cancer, it can be life-threatening or life-changing. And so how do we assess that kind of a case? What do we do? And so we're going to talk about that today. Amanda's handled many of those cases with me. We screen those cases very, very carefully. We listen to the stories. And, the stories can be heart-wrenching at times. And we're here for you. So if you have a situation where you believe you or your family member has been misdiagnosed or was not diagnosed for some type of a cancer, and you believe that it caused injury and or hopefully, and terribly I should say, death, please give us a call too. And we'll take our time. We'll listen to it. Doesn't mean simply because there is cancer that automatically somebody has committed malpractice. Fortunately, most of the doctors, have not and don't, right? But there are many cases, unfortunately, where there is a misdiagnosis or a failure to diagnosis, and it's devastating. absolutely devastating. And so with those cases, we look at them differently, and we have to assess them differently. And so we're going to talk a little bit today about how we approach those. What happens when a client comes in? Amanda does an amazing job screening them. Amanda's a person that has a heart. So when you have a person who has a heart, you really have one step up on everything because you have to take the time. Right, Amanda?
Yeah, I mean, like I said, it's a pretty complex process, whether it's going through the records, talking to the client, figuring out and speaking with the experts and figuring out what the departures are. You know, it's a lot to do. And like you said, you have to have the heart in it.
Right. And so we are here for you folks, and for any other type of personal injury matters that you might have. It really is our privilege to do them. It's our privilege to represent you. It's our privilege to try to get you justice. So we will see you on the other side as we continue talking about this specific area of medical malpractice and misdiagnosis of cancer and failure to diagnose. Okay, so we'll see you on the other side. Well, welcome back to our program. If you're just joining us, this is personal injury attorney Ken Auerbach. On the program, our program, From No Fault of Your Own, have my great co-host and trusty associate, great associate, Amanda Spinner, with us. And we're exploring some of the most important issues in personal injuries caused by accidents. If you call into the studio right now at 631-451-1039, we would be glad to answer any question you may have on personal injury. And Amanda, what do you got for them?
We would love to give you a From No Fault of Your Own t-shirt.
And if you or someone you care about has been injured as a direct result of someone else's negligence, really, give us a call. Contact us. How, Amanda?
You can give us a call at 631-654-4900, or you can contact us on the web at myinjuryli.com. Again, it's 631-654-4900 or myinjuryli.com.
It would be our privilege to fight to get you justice. All of our consultations are free. And if you do hire us on a personal injury case, we will go ahead, we'll come to your house, go wherever you need us to go, but we will not charge you unless we are successful. It's called a contingency fee, and we will do everything we can to the best of our abilities to be successful. We will lay out expenses too. You don't have to pay us them back unless we are successful. Listen to our program, Amanda, when?
Every Monday from 4 to 5 p.m.
So we are back on the program, and we're fortunate again. We are being sponsored today by who, Amanda?
Yes, we are sponsored today by Taps and Caps in East Patchogue. So shout out to them. Shout out to Petey. They're opening in mid-August in East Patchogue, so everyone head on out there.
Well, yeah, get ready for it, because I'm telling you, if you go to a place that Petey's holding court, it's the best place. It really is. So, Suzanne, kudos to you that you raised such a fine young man, and we're so excited to have that in Patchogue. We've been in Patchogue, Amanda, for a long time,
yes.
Our office, and we could use a place like Taps and Caps.
Definitely.
So, Amanda, let's get back to what we were talking about. We were talking about misdiagnosis of cancer and failure to diagnose.
Right.
And so when we're talking about cancer, Amanda, there's various types of cancer misdiagnosis, failure to diagnose cases that we've handled, right?
Yeah, I mean, we've kind of handled the whole gamut of cancer cases. But what's interesting specifically about cancer cases is that the statute for medical malpractice is normally 2.5 years. But recently, in I believe 2018, the law changed where there's now a 7-year full statute of limitations for discovery of cancer, because oftentimes we don't discover it until later, as you know. And
I think that was for once, you look at it and say, did the legislature step up and really make a difference, right?
Right.
And I have to give kudos to the legislators where they realized that just wasn't fair, because what could happen would be you'd be treating with a doctor, and maybe you stop treating with the doctor or a medical provider, and there would be an indication to that doctor, or should have been an indication, that you had some type of cancer and they didn't diagnose it. And in the old days, you really were out of luck unless you were continuing to treat with that doctor. Is really the only exception. It was called a continuing treatment doctrine.
Right.
So if your care ended and 2.5 years went by and you had that ticking time bomb inside of you, and then you discovered it after the 2.5 years, you're out of luck.
Right.
Statute of limitations ran, you couldn't do it. Very different now. Now, from when you reasonably should have discovered it, there's a statute of limitations that extends that 7 years from when you reasonably should have discovered it.
Right.
So we have cases like that. We've had lung cancer cases like that. We've had various types of cancers, kidney cancer cases. The reality is that these are unique cases, and they have tremendous repercussions. If somebody doesn't diagnose you potentially, let's say, with a hernia, it may, and it can be catastrophic, but oftentimes it's not going to be catastrophic. You're going to be in pain. It's going to be something that you're going to have to deal with, and it's not certainly something that you should have had to deal with, but it's not life-ending or changing.
Right.
In a cancer case, when we get these cases, and sometimes they break your heart.
Yeah, I mean, like you said, kind of every cancer is unique. So the fact that one cancer may metastasize really quickly and take over very quickly is very important to these cases as well. Because again, every type of cancer is different. Ovarian cancer is different from kidney cancer, is different from lung cancer. So I find them to be very fascinating cases. But, it does require a lot of work.
Yeah. And, when the case comes into us, when we're first analyzing it, so there was a misdiagnosis of cancer. Somebody will come to us. Well, we have to make sure, was it really cancer?
Right.
Okay. Or was it not? Okay. Someone could think that it might be, but was it or wasn't it? And then we have to first look at those records. We have to know that. Then we have to see, what type of cancer was it? Mm-hmm. And all right, the next question is, and as we said earlier today, is, okay, let's say someone misses it. Mm-hmm. There's still a question of what?
Damages.
Right. So is there a connection between that failure to diagnose or that misdiagnosis and ultimately what your injuries are and what the ultimate result is?
Right. And I think sometimes in these cases it can be tough because let's say you have a slow growing cancer and, it would have been the same had they diagnosed it 3 months earlier as when they diagnosed it then. It's hard to then tell someone, well, the damages aspect isn't really there. But there are other cases where it's an aggressive cancer and 1 or 2 months can mean a lifetime. So
what we do is we go with truth from beginning to end. We respect our clients and we respect the fact that when they come to us and they have potentially a life-changing situation or a life-altering situation, we're going to give you the truth.
Exactly.
Okay. And we'll tell you that. Well, we have to analyze it. We have to look at it. We have to have our experts look at it. We have to see specifically what type of cancer cells there were.
Yep.
Okay. How fast does this cancer grow? And if it's a cancer that otherwise they should have A, discovered, and B, if they did discover that there would be much different treatment or a much different result, those are cases that we're able to do.
Yes.
And so every case is different. But what we're not going to do is we're not going to tell you when you come in on day one what the case is because we really don't know. Okay. We haven't analyzed the cellular structure of it. We haven't talked to our expert and say, all right, what type of cell is this? And how long would it have taken for it to get to a certain stage? Right. And when would it have been different? That's the reason why we have to go to our experts. We have to talk to them about it. And we have open discussions with you folks because you've now felt, rightfully so, if you've been misdiagnosed, there's a failure to diagnose, that you've been mistreated.
Right.
And that you really are deserving of someone to be honest with you, someone to listen to you, someone to certainly have empathy and sympathy with you, but someone's going to tell you the truth. And I never found it useful where somebody comes to you and they have some type of life-altering situation or changing situation, and now you're just sort of telling them maybe what you think their itching ears want to hear.
Right.
That doesn't accomplish anything, and you're entitled to more than that and better than that. So if you think you have a case and you're not sure, give us a call. We'll take the time on the phone with you either way. And our hope would be that at the end of it, that you're able to make a recovery and get through the process. Even if you can make a recovery and go through it, it still doesn't mean that there's not a case. There are some significant cases we have where a person now has to go through very, very aggressive treatment, Amanda, versus what they'd otherwise have.
Right. Sometimes they need aggressive surgery. Sometimes the cancer spread to other areas of the body that it wouldn't otherwise have. So we have a lot of cases like that. And if you or someone you care about, if your loved one has been failed to be diagnosed or misdiagnosed with cancer, please give us a call at 631-654-4900. We would be privileged to represent you.
And, you may or may not know it if it's a relative and it's somebody who really isn't able to speak, and you're able to speak on their behalf and they give you the okay to do that. You can call us too, because sometimes when people are going through treatment, they need someone else advocating for them. So as long as they have your permission, and we'd assure of that, we'd be glad to speak to you. Also, a lot of times it comes to us in the form of a relative.
Yes.
It's a child or somebody close to you. So please reach out to us. We'd love to be able to help you. Love to be able to get you justice. Okay. So we're going to come back on the other side. We're going to have Dr. Frank Segreto. We've had Dr. Segreto on the program before. He's going to talk about orthopedics. And we're going to get into a little bit more about surgeries and the type of surgeries and some of those aspects of it. So we'll see you on the other side. So glad to be here. Well, welcome back to our program. You're on our program for No Fault of Your Own. So glad to be here today. And hey, Amanda, I heard that you saw a great show from the great Dana Totoro over the weekend.
I did. She is currently starring in Shakespeare's The Twelfth Night. That's the name of it.
Where was it?
So they're performing all over Long Island, town of Islip actually, but it was at Heckscher Park, right on the beach. It was beautiful.
And this was literally a free show, right?
Yes, you just pay $10 to get into the park, and the show is free.
Wow. So, what do you think? Dana's performance? Tell us about it.
Dana was amazing as usual. Honestly, the whole cast was great. It was a fabulous thing. It was nice to be outside. The wind was blowing. Dana and her mom and I hung out. So it was nice.
So if people want to go see the show, how do they get tickets? What do they
you don't actually get tickets. You can, I believe, go on to the Facebook page of the Islip Arts Council. Yep, or Studio Theater Long Island, and they have a list of their shows, which I can actually let everyone know.
All right, well, we'll get to that. We'll tell them in the next segment here.
Okay,
as you get it. But this show, of course, is being sponsored by our soon-to-be newest restaurant and bar in East Patchogue on South Country Road, Taps and Caps. I'm proud to say it's my nephew and his family's bar. And Petey Mitsos. It's going to be the greatest place. I just know it. Okay. If Petey's there, it's great. Okay. It has to be great. And then, Suzanne, of course, his mom, is always there supporting him, and it's going to be a great place. So we're excited and I was thinking that what we can do is, cause it's Taps and Caps. Mm-hmm. I'm thinking for when they first open up, Taps, Caps, and from No Fault of Your Own shirts. How's that?
Yes, I love it.
So what we're going to do is when we know they're opening, folks, we're going to give them a bunch of shirts that they're going to be able to give away for free. And if you tell them that you heard you heard them or us announce them on the show, and that's why you're there. Well, I don't know how many we'll give away. We'll give a bunch away. You go in there, they'll give you a beautiful shirt, get a free T-shirt, and then you'll have a great place to go. So we'll let you know when that's opening, and we'll certainly get to that at some point. And proud of you, Petey. Petey, by the way, has 1,788 hats.
1,788. Wow.
Right. I've never heard of anything like it. Right?
I've never heard of anything like it.
Okay, so let's get back to what we're talking about on a more serious note, Amanda. We're talking about representing people in cancer cases. Now, we originally were going to have Dr. Segreto on the show, but he had an emergency with a patient. And when a doctor has an emergency, we understand that, folks. And that's where the doctor should be. The doctor should be doing that. So we'll get him on in another show, but we have plenty to talk about here today. We're just sort of scratching the surface now, Amanda, of handling cases involving diagnosis, failure to diagnose, and misdiagnosis of cancer. And so let's kind of talk about some of the other aspects of it. One of the things that is very, very difficult sometimes is to explain to someone that we got to take that time to evaluate it, right?
Right. I mean, oftentimes because this person is either dealing with it or they've, dealt with it, they're like, I know I have a case. This is it, blah, blah, blah. And while I commend them for that, we still have to do our due diligence on our end. And like you said, we actually are required by New York state law to speak with a physician, and we file what's called a certificate of merit when we file suit in a medical malpractice case, which is different from any other type of personal injury case. So we actually have to swear that we spoke with a physician and that a physician says, yes, there is a case.
And some of these cases that we have, it's not necessarily on an elderly person, all right? Because it's not only elderly people that get cancer. It literally could be someone from all different ages.
Yep.
And, different cancers are more prevalent with regard to people of different ages, but it's not necessarily the case. And, we have a client, and we have many clients, but, we're handling cases of ovarian cancer. And ovarian cancer can be devastating.
Yes.
Be absolutely devastating for someone. And, we encourage all you women out there, please make sure that you get your regular checks.
Yes, please go get your yearly exams, get your pap smears, push for everything that you can. If you think something's off, you need to make sure that you let that be known to your physicians.
Right, because our hope is that we would never, ever have to hear from you, okay?
Yes.
But make sure, though, that you're taking care of your part of it, okay? And that's also important because, when we have a case, one of the defenses, Amanda, with regard to a case in terms of whether or not a doctor or physician is liable, is taking a look in terms of whether a patient had symptoms and failed to otherwise now go ahead and go to a medical provider, right?
Right, exactly. If you don't go to a medical provider and you think there's something wrong, there is no failure to diagnose or misdiagnosis if you never went. So you need to be proactive about your own treatment and make sure that, you're getting the care and treatment that you need.
Right. And we want you to be proactive first and foremost because we want to minimize any possibility that you can have a serious illness or have the disease at a stage where it's going to be much harder to deal with. But the realities are that it's important. Get the testing. So whether it's your yearly gynecological exam, please don't put that off. Whether it's your yearly exam concerning a different type of cancer. And, if you're more susceptible to certain types of cancer, you may be on a different schedule.
Right.
We have clients that, for whatever reason, they have a family history, and their doctor may want to see them more often. Their doctor may have done a pap smear, and that pap smear may have shown some type of irregular cells, and it may not mean that you have cancer, but it may make you more susceptible for the possibility. So listen to your doctor, get that direction. And if you don't think your physician's paying attention, okay, that's a warning right there. Go to somebody that is paying attention. Many really wonderful doctors, physicians, people who really do care. And if they seem too busy for you, my advice to you is then get somebody else. Get somebody who's going to take the time because you never should be too busy to get it right.
Right.
And so we've had cases over a course of time where when we look at it, when we ultimately analyze it and say, well, how did this happen? How did this get missed? Some of the factors that come up is either someone is too busy and they really didn't pay enough attention. Someone is not listening to your complaints. Mm-hmm. They're not a person who listens. Mm-hmm. And those factors, the human factor, cannot ever really be ignored because the fact is that we don't believe anyone intentionally. There's no one that's believe intentionally wants to make you to have or get cancer. Mm-hmm. But those factors are people not taking the time, people not looking at the records, people not listening to your complaints, people not having a willingness sometimes to think outside the box. So we've had people who have been making complaints, and that doctor maybe has been doing the same thing year after year after year, and they've been what they call a little long in the tooth. I mean, in other words, they've been doing it for a long time and are not keeping up with the most recent types of tests and most recent types of information. And so now you're not getting the best care. And so in that situation, we've had cases, sadly, where because of that really is what probably made their situation worse.
Right.
So we don't want that to happen to you. Our show, of course, is if you are hurt, please come to us. Give us the opportunity. We'd love to try to help you. But we try to encourage also on our show ways to avoid there being incidents, ways to avoid there being car accidents, ways to avoid there being incidents of malpractice which are not diagnosed. Okay, we're not looking for business that we don't need to have. We don't want you to be injured, but if you are, Amanda, it's our privilege, right, to represent them.
Yes, and please give us a call, 654-4900.
Or get us on the web at
myinjuryli.com.
So we'll see you on the other side for our last segment. So glad to be here. Well, welcome back to our program. If you're just joining us, it's personal injury attorney Ken Auerbach with my great co-host and associate Amanda Spinner. Wouldn't have a great show without Amanda. So we're so glad that you're here with us today, Amanda.
Thank you.
So glad we have the great Dana Tutora of course. Going ahead and getting us all over the web. And we love doing that, actually, Dana, so that people can know that we're out there. Some people don't turn on the radio, and then they get us on the web.
Yes.
So it's all good. If you or someone you care about has been injured as a direct result of someone's negligence, please get a hold of us at 631-654-4900 or get us at myinjuryli.com. That's 631-654-4900 or myinjuryli.com. It really would be our privilege to fight to get you justice. All of our personal injury cases that we take are all on a contingency. It doesn't cost you a dime unless we make a recovery. We'll also lay out expenses. You don't pass those back either unless we are successful. And you can listen to our program every Monday from 4 to 5 p.m. as we explore these issues. We're being sponsored by, soon to be, the new great Top Bar and restaurant, or one of the great top bars and restaurants. I think it's going to be the best. Taps and Caps. Petey Mitsos and his family, the Mitsos family, and his mom, Suzanne Mitsos. And we're excited that they're going to be opening up on South Country Road in East Patchogue in mid-August. We told you already that we said Taps and Caps, and we're going to give shirts away when they open it up from No Fault of Your Own T-shirts. But they told us what they're also going to do is if you come in there when they open up and you say that you heard them or heard about them on our show, they're going to give you a free drink too.
Ooh.
Okay, so we'll tell you when that's going to happen. We're going to tell you when that promotion is, when you could walk in there and get that one free drink and a great T-shirt. It would be our privilege to do that, and we're excited. We're excited for you, Petey, and 1,788 hats. What else is there to say, Pete? You're in a class by yourself. So let's get back to talking about, if we could, Amanda, before we do that, we got to talk about Dana.
Yes. So before we do that, I'd just like to say again, if you guys were listening, there's free Shakespeare in the Park, and currently they're performing the 12th night. That's through the Islip Arts Council and the Studio Theater of Long Island. These are free shows, so you really can't beat it. On July 27th, they will be performing at the lot behind the IAC Gallery in Bayshore at 5 p.m. August 3rd, they'll be performing at the Long Island Maritime Museum in West Sayville at 6 p.m. On August 17th, they'll be performing at the Bayshore Bandshell in Bayshore at 6 p.m. And their final performance will be August 27th at Brookside Park in Sayville at 2 p.m.
Mark my words. I'm telling you, mark my words, you're going to be able to say someday, so the great Dana Tutora.
Yes. Okay.
And I'd like to tell you, those are not going to be free events when you have to get to see her at that point. So right now you get to see her for free. But we're really excited for her, and she's really doing a great job out there entertaining Long Island. So let's get back to what we were talking about previously about the cases that we do, medical malpractice. And we've been talking about today the cancer type of cases and the cases that we're dealing with, misdiagnosis or failure to diagnose cancer cases. And we were talking about that we deal gynecological cases. So we have ovarian cases. You can have cases that are dealing with the uterus and different areas of the female anatomy. But there's just various types of cases that we've done. We've done skin cancer cases.
Yes.
And, skin cancer cases are very interesting because from the standpoint of it really does make a difference as to what type of cancer there is on the skin.
Yes.
Okay. Whether it's a basal cell carcinoma, whether it's a melanoma, for instance, in terms of where it could spread, and how fast it could spread, where it's located, has it metastasized, has it not metastasized? And so when we get those cases, we try to get as much information as we can. We try to make sure that we secure if there's photos that have been taken with regard to a cancer spot on someone's body. When you go to a dermatologist, okay, and you're going there, you need to make sure that you do report to them and tell them if you've had a site that has changed in any way, a site that's maybe bled some. So you have a job too, okay? And your job is to make sure that you report, okay? It's no reason, don't hide it. Don't be embarrassed by it, okay? Everybody deals with something. Make sure that you do that and make sure that you're going for oftentimes a yearly exam, okay? I just got done with my yearly exam with my dermatologist, and I've had situations where I had a couple of spots of basal cell carcinoma over course in time, and they took care of them. And, it's really important that you don't stick your head in the sand. So please go there, get your exams, go through it, and you're going to find out that you'll feel more confident. And as you go through the process, it'll be better. You'll have this relationship so that you'll trust this doctor, but you'll report these things.
Right.
And when you go to the doctor, if you go to a doctor and that doctor's not taking the time to do that exam and you really feel like they're just giving you short shrift, get a different doctor.
Right. There's a lot of things, like you're saying, that can be preventable, including colon cancer. One of the biggest, most preventable cancers is colon cancer. So everyone really needs to be getting their colonoscopies, getting your screenings done. Especially if you are of a particular age or if you have any symptoms. But like this show, it's about, educating people, but it's also about preventing things that could happen in the future. And one of the biggest things is cancer. So if you have the opportunity to prevent yourself from getting it, avail yourself.
I think that's great, Amanda. Colon cancer is one of the cancers that can be simply prevented.
Yes.
So it's one of the cancers where if they catch it and there's a polyp, and which means they'll say there's a malignancy, and the polyp may be or may not be malignant, but let's say it's malignant. If it's contained within the colon, it's a closed system. And so what they can do is they can go sometimes just remove that tissue. Sometimes they may have to resect it and take a whole piece out. Bottom line is, though, the beautiful part about it is if it's in there and it has not metastasized outside, then you're good, okay? The sad part is, really, when it comes to colon cancer, is nobody really should be suffering from metastatic colon cancer. Nobody. If you just got the right examination and you make sure that you get your colonoscopies and you get your follow-up. So please, again, we're not looking to have cases that we don't have to have. We don't ever want to see you come down with some type of disease that could be avoided. Please get that treatment. Make sure you get to a good doctor. Make sure that that's a doctor that cares, that's paying attention. Oftentimes, we've had those cases where what we see is that the doctor is just either too busy, not paying attention, not listening. And then we look at it and, as we're looking at the records, Amanda, I know you feel the same way. Sometimes you want to scream. I know we just had one, Amanda, that we were taking a look at, for a different type of cancer. But, I said to you, right, when I looked at you, I said, I can't believe that this happened, right? And our thought process is, it happened, why?
I just think carelessness. People were looking at different aspects. There was something else going on with this gentleman. I also think it's important that any care that you got during COVID, because maybe your loved ones weren't able to come in with you and be present and be a part of it, you need to be really active about what occurred during that time. And that was kind of a good example of that. The family wasn't able to go in with this gentleman into the hospital on several occasions. And not to say that would have prevented it, but a lot of times our family members are proactive and asking questions and saying, give me this, give me that. So I think that's important too, another aspect to it.
Well, it's been a great show.
Yes.
And so we're winding it up here. If you or someone you care about and love has been involved in some type of a situation where you're involved with someone who's committed negligence and it's caused injury to you, get us at 631-654-4900 or on the web, Amanda, where?
At myinjuryli.com. Again, that's 631-654-4900 or myinjuryli.com.
Be our privilege to help you and get you justice. And have a wonderful, a safe week in preventive medicine, right?
See you next week.
Bye.